Make us live. Yeah, so we can start.
Okay, so hi everyone. First of all, welcome and thank you for joining us for the third session of our webinar series. On behalf of the whole Youth Health Forum's Youth Leadership Group, I'm really excited to have you all here today. My name is Jahin and I'm one of the YHF Young Leaders. We form a group of 10 who meet on a monthly basis regarding forming different health recommendations for young people around Australia. And today I'll be hosting and moderating the chat today. Just a very quick thing about me. I am a second year optometry student. I've been involved in youth organizations since I graduated in 2018, and I've loved it ever since. Involved with like health research, young people's needs when it comes to the healthcare, political participation, everything of that sort. So before I begin, I'd also like to acknowledge the traditional owners of the land, which we are all joining this meeting from. For myself, I'm in Canberra, so that is the land of the Ngunnawal people. I would also like to pay my respects to the elders, past, present, and emerging, and acknowledge that sovereignty was never ceded. So just a bit of formalities about the webinar. This webinar is the third in the series that the CHF has been running. Each of the webinars explores a specific topic selected by the Youth Health Forum, and we basically look at things that we wish we had known more about when we started our advocacy journeys. Today, we're actually talking about communication, and we've invited two exceptional individuals who have spent their careers communicating about health through different mediums such as journalism and also providing healthcare and health advice to young people. The aim of this webinar is to help you better understand what you can achieve if there is an issue that you'd like to see addressed and how you can move forward, to do that. So we have already received some great questions in advance to this webinar. So this will be an interactive webinar as well, and we have lots of time afterwards in a Q&A session for questions with our expert speakers. I do really encourage everyone here today to post questions in the chat as we go. Myself and Caroline from CHF will be monitoring the chat as we go through the webinar. And also, just a quick note, any sources, slides, or resources that you see today, we are able to share after the webinar will be made available to you. As well as that, just a quick thing about the YHF. For anyone who's never heard of the Youth Health Forum and is joining us here for the first time, the YHF was launched in 2018 by CHF to increase youth representation in the advocacy spaces and to better represent young voices in the diverse areas in Australia. The Youth Health Forum members are aged between 18 to 30, and they come from all around Australia with diverse backgrounds, identities, and most importantly, lived experiences. There's a wide range of knowledge about health services, with the involvement of NGOs, for myself personally, youth organizations, community sector. We have individuals from like multicultural organizations as well, and engagement with local issues. A lot of individuals are also passionate about getting involved with the local community. So what the YHF does is that it's been funded by the Commonwealth to provide advice and leadership in youth health policy, and also to just better equip young people with advocacy skills and the knowledge required to be meaningful in discussions that involve young people and just people in general when it comes to the healthcare. Also, thank you to Origin. We have to thank our partners, Revolution in Mind, who have generously supported CHF's young leaders to design and deliver this webinar series. We appreciate their ongoing investment in young people and young leaders and their commitment to co-designing with young people across evidence-based research, policy development and clinical care, and we acknowledge the high standard that you set for organizations working with young people. So without further ado, we'd like to start with our first expert speaker. I'd like to introduce Associate Professor Melissa Kang. Associate Professor Melissa Kang has devoted her career to the health and healthcare of adolescents and young adults. She is an academic, a clinician, and an advocate. Melissa's projects have focused on access to healthcare, health system navigation, young people's sexuality, and sexual health. For many years, she was the Dolly Doctor at Dolly Magazine and is the current president of the Australian Association for Adolescent Health. And we'd like to pass it on to her to provide a very quick presentation about the topics on communication and effective communications in health research.
Thank you so much. Thank you, Jahin, and thank you, Carolyn, for inviting me to this. And hello to everyone who's here today, and also those of you who might watch this after the event. I'd like to also begin by acknowledging the traditional owners of the land that I'm sitting on, which is in the Darug Nation in Western Sydney. And I'm out here today doing one of my clinical days. But I'm about to tell you a little bit more about my background and the kinds of different kinds of knowledge and different kinds of content and different kinds of ways of communicating that I bring depending on the audience and depending on the platform. So I have prepared a really short PowerPoint presentation, mostly with pictures, just to try and illustrate the kinds of points I'm going to make. So I'll just begin by sharing my screen. Okay, so this is a webinar series about advocacy as young people, and I am absolutely delighted to be invited to this. I was delighted when the YHF formed. I think I was there at one of your inaugural meetings in Canberra, and I have spent most of my career working with adolescents and young adults as a doctor and also as an academic and researcher and educator. So I really, you know, I've always tried to find the best ways to involve and engage young people in the work that I do, but it's difficult sometimes, you know, depending on the setting that you're working in and the system constraints and bureaucracy and all sorts of things. So to actually have at federal level a recognition that young people as health consumers need to have their voices heard is very, very inspiring for someone like me who spent many years kind of waiting for these times to come. So the information that you all have from CHF about this webinar series has talked about these kind of 4 objectives for this particular webinar today. And what I'm going to probably mostly focus on is, and also because I've spent so much of my career doing research and trying to translate it, I'm going to also talk a little bit about that. And perhaps right at the end, or I can maybe answer some questions about the other 2 points. So just to tell you a little bit about my own professional background and how that has informed the way I communicate with different audiences and different platforms, I've got a few pictures to show you. So this is some of the team that I work with as a clinician in Western Sydney. So this is at one of our services near Parramatta, which is a big city in Western Sydney. And these are some of the nurses and community access team workers and youth health workers that I work with. And the reason we're all wearing our fantastic uniform is because we formed a band of outreach COVID testing. We went out into the community all around Western Sydney, targeting homeless young people and older people, and vaccinating them against influenza at the beginning of the pandemic, and also offering COVID testing. So that's our team, dressed ready to kill. We called ourselves the COVID Street Fighters. So that's my work as a doctor, and that's some of my team members that I work with. The other main part of my work has been research, and here's a group of our youth consultants that was involved in a big study that I and many others were involved in New South Wales about 4 or 5 years ago, and it was called the Access 3 study. So that's a picture of the final report and the first page of the survey, which was completed by about 1,400 young people around New South Wales. That research took about 2.5 years to complete, and one of the outcomes of that was the current New South Wales Youth Health Framework. So it directly fed into policy, which is the current policy today. So that's sort of the nature of the work that I've done around research and access to healthcare, is to make sure that what we learn from research involves young people as much as possible, invites young people to participate as kind of like experts, I suppose, consultants, and then as research participants as well, and translating that knowledge into policy and practice as well. So as Jane mentioned, I don't know how many of you know the magazine Dolly. I think if you're in your 20s, perhaps mid-20s, you will remember Dolly, but I certainly meet a lot of teenagers in my clinical work who don't know Dolly at all, so that's getting a bit sad. The magazine closed down in 2016. You might recognise the model on the cover. I met Miranda Kerr when she was a 14-year-old and had won the Dolly model competition, so that's kind of my only claim to fame, really, that I met her a long time ago. I wrote the medical column for Dolly Doctor for 23 years. So questions that were originally mailed in using stamps and envelopes and pieces of paper, and then by email and then by messenger. So thousands and thousands and thousands of questions that were sent into the magazine over that period of time. And I would answer a handful of them each month as part of the Dolly Doctor column. And as I'm currently the president of the Australian Association for Adolescent Health. We do a whole range of things, but one of the big things we're really keen to do is advocacy and to involve young people. I'll talk about that right at the end. So that's just kind of a bit of the spectrum of work that I'm currently involved in and kind of have been for much of my career, really. So to talk about communication and how to do it effectively and the different platforms and audiences. So here are some pictures of, you know, clinicians, I suppose. And what's, of course, been really interesting in the pandemic has been the switch to virtual consultations with health professionals or telehealth. Now, where I work as a clinician with young people who are marginalised and homeless, we have found that telehealth for them hasn't really been their preferred way of being consulted with. So we have continued and maintained absolute business as usual clinical service for the young people that access our services. But we work with GPs and perhaps some of the mental health services where they have switched predominantly to telehealth. So we're learning quite a bit about how young people find that experience. And communication with a young person one-on-one as a patient when I'm a doctor is naturally going to be quite personal. It's going to be very much listening, making sure that the language I communicate in is understandable, and also that I understand the language that young people use. So it's very much a two-way, communication is very much a two-way street. But a young person will come and see me as a doctor because they have a health concern, and it's my job to listen and to assess and to work with that young person to figure out what is going to work best for them to support their health and well-being. And that, you know, all my career has been done pretty much face-to-face. I've probably only done a couple of telephone and telehealth type consultations, but have been talking to lots of my colleagues who have switched predominantly to telehealth, and some of the challenges, but also some of the opportunities that brings for a lot of the young people that my colleagues see. So I just thought I'd show you some Dolly Doctor questions that have come in over the years. I have literally thousands of them sitting in boxes at home. And these are copied without any changes to the spelling or the punctuation or the grammar. So when I'm talking to a young person in my consulting room as a doctor, that's very different to talking to an audience of possibly 500,000 readers of a magazine. And that was the challenge when I first took on the role as Dolly Doctor, was how do I communicate my medical knowledge to an anonymous person who's written a relatively short question. I don't have the opportunity to ask more questions or to put it into any sort of context. But this is a 12-year-old girl with some symptoms. And if I were to see her in my consulting room, my approach in terms of communication would be very different than when I'm writing perhaps a 200-word answer to a question that might go out to 500,000 readers. So that's a very different challenge. And I suppose over 23 years, I like to think that I got better at it. I think probably for the first couple of years, I bumbled around a bit trying to figure out, you know, what the key messages would be in such a short amount of word space. And with help from colleagues, sometimes with help from young people looking at some of the questions, which were all anonymous. I think I sort of eventually got the hang of it. So here's one, and I just put them here for you to think about. Well, how would you answer this if you only had 200 words or 150 words, and maximum maybe 300 words, depending how generous the sub-editor was feeling? Yeah, how do you respond to this question in a way that is helpful, I guess, and not just helpful to the person who wrote the question, but to the whole readership? And here's another example, really common. These kinds of questions were really common. And again, there were a lot of questions about, is this normal? Am I normal? Are my symptoms normal? And I tried to be very reassuring, but sometimes I wondered if I used the word normal too much, because what's the opposite of normal is abnormal. So if you don't say normal, what are you implying? So these are the kinds of things I had to think about, the implications of what I was writing, and how do I communicate so that I'm clear and hopefully sort of at least partially answering the question without conveying too much anxiety, but also helping that young person feel like they had better control of their health and where else they could go for help if they needed it. What happened over the years on several occasions was that because I was given access to so many questions by the magazine, I was able to do some qualitative research, because I'm also a researcher, and I was interested to see if we actually categorized the questions and counted the number of questions, what would we learn? So what I'm going to show you is a little bit of a subsample of questions that came to Dolly. You can see on the left-hand side, I analysed 1,000 emails that came in over 6 months. So there were 15,000 emails in a 6-month period. This was in about 2006 or 7. And I extracted 1 in 15 of those emails over 6 months. So I had a sample of 1,000. Then I sat down with 2 colleagues. One was a psychologist, one was a GP, and we coded them. And what you're seeing here is the 319 of them, which were classified as somehow related to sexuality or sexual health or concerns about sex. And that just shows you the number of emails that fitted into those categories across the bottom. On the right-hand side, so another thing I did for a couple of years was a talkback radio show. And that was a very long time ago as well. So it was called the Hot 30 Countdown. To be honest, I don't know if it's still around. But I was actually the guest once a week with Kyle and Jackie O when they were doing evening radio. So they weren't nearly as sort of famous as they are now. And what happened was, over 2 years, I used to write down the questions that would come through that would be broadcast live on air, and I was able to categorize them as well. What I then did was, well, let's look at what young people are taught in school about sex education and what health promotion messages are, and what doctors and parents perhaps talk to young people about. It's things like this: STIs, contraception and STIs. But when you look at the numbers, going back to the Dolly Doctor email analysis, they're much more interested in other things like sex itself. What is it? What are the different sexual practices? How do they work? Masturbation was a common question. Same-sex sexual attraction, sexual arousal. These were more common concerns in terms of the questions that were sent in anonymously than things like STIs, which is what you learn about in school. So what this did was, we then went on to publish the analysis of those 1,000 emails. So that was the research part of it. But then what I was also able to do was present some of this research in a whole lot of different forums, including teachers who teach sex education. So what I wanted to do then was convert my work as Dolly Doctor and communicating that, and the analysis I did on the questions and how that turned into a scientific research paper, into communicating to a range of different audiences. So I had to decide, well, what were my key messages? So here were some of the key messages. Young people on the whole have a lot of curiosity and concern about their bodies, relationships, and sex. As a bit of a sidetrack from that, what that has allowed me to do when I'm perhaps, for example, presenting a research study to an ethics committee. And I say to them, I want to interview young people or do an anonymous survey with them about sex. And an ethics committee that doesn't have young people on it might say, oh, you can't ask young people about sex, you know, they'd be too embarrassed. I can then turn around and say, well, look, you know, they have lots of curiosity and concern about sex, and it'd be really helpful in terms of research and informing practice and policy to learn more. And I can also say to ethics committees, you know, as a doctor, when I engage with young people and talk to them confidentially about sex, they're very open, they're very willing to talk about these things. So, you know, that's some of the messages, is that young people have a lot of curiosity. It's not something that's, you know, that they feel, they might be embarrassed to talk about it, but they would really like to be able to talk about it. The other thing that came out of the Dolly Doctor research was that there are many topics that sex education doesn't always cover. And there are other people that have done other great studies that have looked at what young people want from sex education as well, and what they learn from sex education. So we know that it doesn't quite match up, you know, when you kind of analyse all the questions that came in. Most of them were from girls, I will admit that. But when you even just looking at that, you kind of say, well, there's a bit of a mismatch between what they're taught in school and what they'd like to know when they feel that they can write to an anonymous magazine about this. And also that we need to involve young people, or at least their ideas and wishes, when we're designing relevant sex education. So these were the key messages that came out of Dolly Doctor research. So then what happened was that trying to communicate those messages varied with my audience. So one thing that happened about 6 or 7 years ago was I was asked to present some of this knowledge, some of this research and some of my perspectives to an audience of senior health promotion workers in New South Wales. And I think because some of this research, there were other speakers as well who had done excellent and really interesting work. One of the things that happened out of that was something called the PASH conference. So the Positive Adolescent Sexual Health Conference, which happens not this year sadly, but happens up the north coast of New South Wales with several hundred Year 10 students. And it's turning some of the messaging around sex and sexual health into positive messages and kind of listening to what young people want to know about. Now, I can't claim that it came directly out of Dolly Doctor research, but I think that was a piece of the puzzle that informed this group of people's decision to do an annual conference on sexual health with schools that looked at positive aspects of sexual health and sex. Another part of my work, which I mentioned earlier, was the Access study, which looked at access to healthcare, health system navigation, young people's experiences using technology and the internet when they're trying to access health information and healthcare. So this picture here shows us presenting to a whole bunch of really important policymakers and others. So young people helped facilitate this day, researchers, we had some clinicians and health professionals, but we had a lot of people from government and from policy making. And we were presenting our research findings to them, and that's what helped, you know, eventually to inform that youth health framework that I showed you right at the beginning. And here we have the New South Wales Health Minister, this was back in 2017, launching that youth health framework at our AAAH conference with Alice there, who was one of our youth consultants, and then Professor David Bennett, who has been a very eminent adolescent health specialist and advocate for all of his career. He's recently retired. So this was a lovely culmination of a whole lot of aspects of some of the work I've been involved in, which is AAAH and research and young people and engaging young people. And Alice spoke about her involvement in the Access study at the time that the Minister launched the policy. So, so this is how communication about, you know, whether it's your clinical expertise or your research, or as a young person, you are experts, and how do you communicate that to a range of different audiences? So finally, just a little bit about AAAH. So it's a national organisation. Members are young people and health professionals, or education professionals, or in fact, professionals, full stop. We're an organisation that tries to bring professionals and young people together to promote the health and wellbeing of young people in Australia, particularly. We have members from all states and territories, although we would like many more. It's free to join if you're a young person that is under 26 years of age, and currently it's free if you're a student, part-time or full-time, however old or young you are. So we have been having fabulous annual youth health conferences, but not this year, obviously. We are having a research showcase in early December, which will be done by Zoom. And that is PhD students and postgraduate students presenting their research. And it's all research about youth health, various aspects of youth health. What I wanted to show you here, though, so we have conferences that present research and bring audiences together to learn about sort of cutting edge research going on, particularly in Australia. But we have put out some position papers and position statements, and that's the screenshot on the right-hand side of the screen where I've highlighted our advocacy. And we've published position papers on access to healthcare, on comprehensive sexuality education, and at last year's conference we launched our position paper on the health and wellbeing of Aboriginal and Torres Strait Islander young people. So we have just, as of today, created another type of publication, which is opinion pieces, and we're encouraging young people to write them, and the first one is up there today, and I'm going to sort of formally announce it next week in a newsletter, but if you go to our website you'll see it there. So feel free to get in touch. I'm the president only for another 2 months. I'm stepping down after 5 years. My term comes to an end, but you know, we'd still love to see the organisation grow, and on our board of directors we currently have 2 young people, and we'll be looking to fill 3 vacancies. So if you're a young person, please think about putting your hand up to join the board of directors. You're welcome to get in touch with me if you'd like more information. And so I just thought, what are the kind of take-home messages from how to communicate effectively if you're a young person wanting to advocate for the health and wellbeing or healthcare services or better healthcare for young people? Trust in your own expertise. I always get a bit nervous before I'm giving a talk, and I have to say to myself, well, look, I'm communicating something that I know about because I've spent a lot of time doing this piece of work or whatever. I'm not a young person. I don't bring a young person's expertise, but I bring my expertise of working with young people in different capacities to my audience. It's also important to know your audience. So, you know, that Dolly Doctor research, I might talk to young people, and I have, about it, and we actually look at the questions together and figure out how to communicate our answers. If I'm presenting to some teachers who teach, you know, health and personal development, it's a different audience. I'm trying to give a slightly different message. I might be talking to policymakers. I might be talking to other researchers. What's the purpose of your communication? It's really good to be clear on that. You know, what is it that you're trying to convey? Because if you're anything like me, I talk on and on and on sometimes. You know, I don't keep track of the time properly and I go off track. So try to be really clear, and if, you know, if it works for you, rehearse what you're saying first. I think that's often a thing I encourage my students, my PhD students, to do, is to practice their communication so their message is really clear. It's not one way though. Communication is never one way. It's always good to be responsive to your audience. It's kind of hard in Zoom, you know, it's hard on a webinar because you don't have that same interaction with an audience. But I think in some ways it's something we're all learning to do in this weird existence that we're all living at the moment. And finally, I think it is important to have some key messages. I've put 5 there instead of 3, so I'm obviously not practicing what I preach, but I think it's really good when you're asked to, or you decide you're going to go and communicate something as part of advocacy, or perhaps you're invited to speak at something. Think through what your key take-home messages are for your audience, and, you know, nut them down first. I always like to start with what my key messages are. So that's all that I was going to say. I will stop there and let our next speaker talk, but thank you very much. I will now mute myself, and thanks again, Jahin and Carolyn.
Thank you so much, Melissa, for that insightful presentation, and thank you again for sharing your background. I myself had the privilege of collaborating with you at the beginning of the year. We created a article for the conversation about young people's response to COVID. So I think, you know, I can definitely vouch for everything you're saying and your hard work and, you know, the tips that you provided. So on to our next speaker. I'd like to introduce Murray McInerney. Thank you to Murray for stepping in last minute. Melissa Sweet, who was originally presenting, had to travel home this week to attend some family matters. So we really appreciate you agreeing to present, especially in such a last minute situation. A bit about our speaker. Marie McInerney is an editor and journalist at Croaky, and also freelances for a range of publications, including BBC Australia, Thomson Reuters, the British Medical Journal, the Saturday Paper, and tech-specific publications, including the HCF member magazine. She has also done media and comms work for a range of not-for-profits, including Lowitch Institute, Mental Health Victoria, Council to Homeless People. She has previously worked as a tutor on writing and journalism at RMIT. So please, I'd like to hand it over to Mary for her presentation. Over to you, Mary.
Thank you very much. Thanks for the welcome. Thanks, Melissa, for your address, which basically shows you what a professional communicator can do, and I'll come with many caveats about that. Can I first acknowledge that I'm working and living on the lands of the Wurundjeri people of the Kulin Nations. That places me firmly in Melbourne, and we're at day 112 of lockdown today, and tomorrow we get to go out. So there are many caveats about that, not least that I haven't had a haircut in 5 months, and that I'm not sure about my communication skills. I went to order a coffee the other day when our local cafe finally opened, and I couldn't even remember how you did it. So we're all a little bit strange. So I'm not quite sure how I'm going to go today. I am standing in for Melissa. She is a real trailblazer in independent media. So I'm sorry she can't be with you. But I'll sort of do my best, and it is a little bit, I was a bit last minute and under the pump, so my presentation is very much based around some very good questions that came through. But first I thought, if you can see over my shoulder, I'm not sure how much people know about Croaky, who I work for as a journalist and editor. And sorry, Carol, I sent Carolyn some slides. I'm not sure if you want to just try and guess where they will come in, but that could be part of our exercise for today about maybe rehearsing. I have some laptop issues too, which is why that's happening. So Croaky is an innovative, non-profit public interest journalism organisation. We provide social journalism with a focus on health equity and the cultural and social determinants of health, and we look at sustainability in health. That means a bunch of things about the way we operate compared to the way mainstream organisations do, but we have some really important strategic priorities. One is to create a sustainable environment for public interest journalism, and that's where advocates in policy, practice, health everywhere play an important and very important role for us. We privilege Aboriginal and Torres Strait Islander people's expertise and voices. We inform, engage and empower communities, or we seek to do so. We seek also to scrutinise and disrupt power constructively, but very much to look at vested interests and what role they play. And we try and demonstrate leadership in the media through innovation. And it's really interesting, Melissa, to have heard what you had to say about that. Fantastic to hear about taking those letters to Dolly and turning that into a bunch of, what I guess we call knowledge translation in some fields, but so very important to think where to position that work and how to actually make it have traction in the community to do good, to improve health. I would point out in terms of, in terms of young people too, that as well as being locked down for 112 days, I have been doing so with my 19-year-old and my 16-year-old, a year 10, who would probably love to go off to that forum. It has been a really interesting thing to see the impact on kids through this, and on families too. So the other thing with Croaky is that, as well as reporting on public health and health equity, we advocate for public interest journalism as a vital determinant of health. And that's probably the main thing I was hoping to speak to you about. In response to a really good question about how can advocates help support fair and independent media in an increasingly divisive media landscape. So I would respond to that first about what is the issue there. It's not just a divisive and divided media landscape, but a very devastated one at the moment. And we comment that it's a cruel irony, really, in the coronavirus pandemic, that there's never been more demand for quality journalism. But the pandemic itself has cut a swathe through an already pretty depleted environment. It was already bad. Newspaper closures in Australia alone over the last decade have left 21 local government areas without a single paper or a news site. 16 of those are in regional areas, and that's a major concern. 25% of journalists, which is an astonishing number, have been laid off by mainstream media companies over 5 years. We've seen operations like BuzzFeed disappear, and they played an incredible role, but also in regional media. Yes, it's increasingly divisive. We've seen that very much, we've seen it in America, we've seen it here throughout the pandemic. There are big problems too with the lack of diversity. It's a very mainstream lens that most mainstream media surprisingly has, and very much campaigning on an agenda. There are also very big structural issues that we talk about it in terms of that it's the business model of journalism is under threat, but that's a lot because I think it is 46% of Australian advertising now goes to Facebook and Instagram. I might be behind on that figure actually. So we've been involved and very much urging people in health to add their voices to improving that landscape, and there's been some parliamentary inquiries that have come up with pretty disappointing recommendations in terms of real innovative funding thinking, regulations, that kind of thing. There's also the ACCC, the Australian Competition and Consumer Commission, has been conducting a very interesting inquiry into digital platforms, Google and Facebook, which is being watched internationally to see really what it can do. And that it's quite complicated, it's very focused on mainstream media, but it also has some innovation. They've been trying to consult widely, and we've been sort of trying to urge wider civil society, and particularly the public health sector, to also be at the table in submissions, but also for the ACCC to want them at the table when it comes to whether there is regulation and governance around whatever they come up with. Believing basically that the readers of the news are as important as the producers of it. So coming back to advocates, sorry, and I haven't even looked at the time. Coming back to advocates, what can you do? I guess is to understand, yes, that healthy media is a determinant of health. It supports democracy, it takes some vested interests, it ensures an informed community. So please contribute to that. Make submissions to government inquiries, complain when your local paper shuts down, those kind of things, campaign for better funding for the ABC and SBS, the public broadcasters that really play such an incredible role. Sign Kevin Rudd's petition for a royal commission. There's been a lot of fuss, a lot of concentration on the fact that it's seen as anti-News Limited, and he certainly raises those issues, but its big focus is to ensure a strong, diverse Australian news media, and that's super important, and to support independent journalism. It's not just us, it would be lovely, you can subscribe to us, but you can subscribe to a whole range of publications, platforms that really need support. And probably my leading into, and I'm not sure if you wanted to just go into more questions or want me to keep talking, Carolyn, you can give me the prompt, but is to say, do great work that we can report on, do great work that lets us talk to audiences that aren't always talked to try and amplify what's being done, and just to always think about that rigour, but also in communicating it in a way that values people and audiences that you're talking to. Would you like me to, sorry Jade, would you like me to stop at this point?
I don't think So I think maybe another 5 minutes if you have a bit more you want to talk about. Yeah.
I'll keep going then. So the other question was, how can young advocates effectively work with media to get issues and ideas to the people who need to hear about them, and how to address the imposter syndrome of doing so as a young person who's not usually seen as an expert? I don't think the imposter syndrome ever fades, by the way, for all of us, and Melissa talking about that, that was really helpful about that bit where you go, yeah, I actually do know things. And I don't want to be too glib, but I think Greta Thunberg is proof that you are not too young. That has been one of the most powerful movements. It's actually one of the few that has created traction in climate action, which is the biggest thing. And the schools protests have been so effective, but also young people have such a stake in the most critical issues of our time, namely climate change. There it is. How old are you going to be in 2030? Because that's how long we've got. And I'm not going to say where the older generations have given up, but they're not moving fast enough, that's for sure. So I think it's actually, you're a huge stakeholder. Perhaps if I do one more, which is, what's the most effective way to work with media if you don't have a list of contacts or a PR service? And that goes back to what I was saying, have something important to say, do good research and policy work, amplify voices that aren't always heard, do interesting things and be on top of issues, like when there's an election, scrutinise it, fact check them, help media find the evidence that you need to make topics move, to bring about action. And one of the ways is a slide well called up, is have a presence, be on social media, because there's a lot said about social media and that it's, you know, so damaging and problematic, but we rely so utterly on it as a platform, but also as to see who is speaking about what. That's where we go to look for. It's a fantastic platform for us, and I think for lots of people. I know Guardian, you can often see I'll see an op-ed pop up one day from a really interesting tweet I've seen the day before, where they just jump on people who have got interesting things to say with evidence and a fresh voice. And to think about innovative ways to do things. And I really like, Melissa, seeing some of the work that you've led into and what you're doing in community at the moment too. And Croaky does, I would encourage you to go and look at what at Croaky's website, because we do interesting things, and we had to reinvent ourselves this year too, because many of the interesting things we started to do we couldn't do anymore. One is that we do very in-depth reporting of conferences. I don't know when that's ever going to come back again, but we're starting to do it with webinars. But one of the best things that we do is called Croaky Go. And it came out of the idea of walking journalism, of wanting to meet together with people, walk around an area that had meaning, and to talk to people who were engaged in that area. And we took that online for the first time recently with the Alliance for Gambling Reform, to do an incredible lived experience virtual walk across the country, and it was really, really effective. So there are all these sorts of ways that that advocates can get involved. And on that note, I think, given time, I can hold the other questions till later. Yeah?
Thank you so much, Marie, for that brilliant presentation, especially providing those practical steps that we can take as young people. I think often we kind of look at things in a very idealistic view, but just seeing how to break things down using social media, I think is a very important step to take. So now we're going to move on to the Q&A stage. As mentioned before, some of these questions have been sent in advance, and a few have been sent during this webinar, as we can see in the Q&A section. So if you guys have any questions from the audience, please put it down in the chat below, and we'll get to answering that. I think we have one from Jasmine, who's part of our YHF group. I guess I'll just hand it to both of you. The question is, on a more practical level, how do you narrow down let's say, a passion you have for a specific topic into an idea, and in a more practical sense, how do you transform that idea into something that gains traction in the media? I think oftentimes we have so many ideas that we want to convey to social media, to the public, but how do we allow that to gain traction? How do we formulate that idea so that people actually sit down and share it, or really interact with it, rather than just having something you say without any interaction? I know it's a bit of a general question, but would love to know your thoughts on that. I think if we start with Melissa.
Well, I'll try and answer the first part. I'm really keen to hear Mari's take on the second part of that question about gaining traction, because I don't know the answer to that myself. Narrowing down an idea, look, I think it's really great to have passion, if that's the right word, or just, I mean, passion is about a burning interest in something, and I think that's always a good way to start advocacy. It doesn't have to be, it can just simply be curiosity, but I think feeling that something matters to you and your community, whether that's a community of young people or your community that you live in, or perhaps a global community of some sort, having a desire to improve things or see change is really important. Then I suppose it's really about letting the passion sit there and not overwhelm the next step, which is about thinking through what it is that matters about that community. So is it about, for example, and I'm just using my own examples here, is it the fact that you think sex education in schools is too narrow? Is that what it's all about? Is it to do with frustration when you're trying to get a health service and you don't get very good service when you try and make an appointment, or when you go to the doctor you never have enough time? Or is it about the cost? I mean, trying to sort of tease out some specific things that relate to that passion of yours that you're trying to change. And I think really all that takes is a bit of time, maybe talking to peers, talking to others, to help kind of distill some of those ideas. And I think it's very hard when you're overwhelmed with passion, and I'm guilty of this all the time. I want to change this, I want, and then people say, but what is it? What is it that you want to change? And it's certainly a discipline I have to learn when I'm, for example, putting in a research proposal or writing or trying to supervise a research student. Is I've got to actually distill out what it is you're trying to answer. You've got to be very clear about what your objectives are. So I'm okay at that when it comes to research. I'm not so great at it when it perhaps comes to talking to policymakers about how to translate that into actionable or implementable policy strategies. So it does take time, and sometimes it takes multiple goes at getting your message clear. So I think that's enough of an answer. I'd really love to hear what Mari has to say about that.
I think you've answered incredibly well too. Traction, it's a very interesting thing. I guess the definition is, what is traction? What does that mean? Does it mean getting media hits, or does it mean achieving goals in terms of how do you shift policy, how do you shift funding, how do you get information out? There's no science to it really. It's so much often luck with the media, but I guess my main thing is to think, why does it matter what you're doing? Who does it matter for? And then to think, okay, where do I go? Where is the place for that? Do I actually, is it, and it's a big thing, and I've done comms work with a lot of organisations, and it, is the op-ed in The Age or the Sydney Morning Herald what you want? Or would it be better for you to have a forum in your own community that somehow gets across? I think it's really important to think about that. So what actually is the change you want to see? And then to think about platforms. And I guess, in my media comms thing, I often say, know who you're approaching when it comes to media, because at Croaky we often get, like, we do public health journalism, but we will so often get something saying, you know, I'm sure you're going to be really interested in this story about this fantastic place you can go and get your feet revigorated and blah, blah, blah. And I sort of go, you might want to look at our, you know, the stories we've been publishing, and it's probably not quite what we're after, that kind of thing. It's fine when it's accidental, but it's you shouldn't do it. It's wasting your own time in a sense. So it's thinking, where do I want to go? What's the best way to do it? But also, as I said before, is to do good work, have strong evidence. A big thing is often around budget time and things like that, where journalists are really looking, media are really looking to know what the detail is that experts are seeing in things. And I think it's, being lead first with your strongest stuff.
Thank you so much for that. I think, again, the whole practical aspect of it is such a great insight to hear from. Moving on to the next one, which is sort of relevant to our time right now and can be quite related. As a young person myself, this is something I have struggled with quite a bit, but it's how can we make engagement with young people be meaningful? When we have young people volunteering their time, giving up work time, to, be part of, health initiatives or write an article, for instance. How can we improve the recognition or, justify their time so that, the outcome they're getting is rewarding enough for them to continue and sustain their passion, rather than just doing something and saying, oh, I don't think what I did today or what, the effort I put into it was worthwhile. So how do we improve that and allow young people to be more, consistent when it comes to, getting recognition and just, being part of the process for a longer period of time?
Well, I'll start. I think as I get, I've always tried to involve young people. I've always had that as a core just approach to the work I do. But I think as I get older, I get crankier and crankier around tokenistic involvement with young people. I think that, I'm better now, I think, at advocating, particularly with my research colleagues, and saying you need whoever the target audience is. It might be young people, it might be, depending on my colleagues' research, it might be, old people. But whoever it is that you're trying to benefit from your research or your work, they need to have a say in this, because they bring lived experience, they bring expertise. They question the things we take for granted, perhaps as researchers or health service providers, people designing health services. We take for granted, we just make assumptions. And so I think that, and it's a kind of long and slow battle. So just to give you one example, and Johin, you're familiar with this, I think, and I mentioned, having to explain to an ethics committee that, it's okay to do research that looks at sexual practices, for example, that it's not going to endanger anyone, and bringing young people in on that, having their voices preferably on the ethics committee, but if not, then at least in the application, is a really powerful way to do that. And I think that's what we need to, as researchers and, let's say, health service providers, be constantly aware of. How do we do it? Well, we have to make time and we have to find the resources. And if we don't, then we shouldn't do it. I think that's easier said than done. In that Access 3 study that I mentioned, there was a budget to have youth consultants. So they weren't there at the initial design phase. That wasn't possible. It had to be written in a very short time frame. It was, the funding was such that it needed to be a team of researchers with research track records. But as soon as we had the go-ahead with that, we formed our youth consultant committee. So they came in at the very earliest stages and were involved throughout. What happened was that, we had in the budget that it would continue the full circle, and that we'd have the young people who'd been involved at the beginning, involved in translation at the end and developing perhaps a resource or doing something. Now it fell apart from my point of view, in the sense that the whole project took so long that some of the young people involved as youth consultants had moved on. It was hard to bring in new young people who weren't familiar with the project, but there were two, and Alice was one of them. So we workshopped a couple of things and a couple of ideas, and in the end, the feeling was that, well, look, we don't need to do a fact sheet. We don't need to do more resources. What we need to do is talk to politicians and bureaucrats and make sure that the policy is implemented. So that's the message in the end that came from that. It wasn't what I expected. I thought we'd have some fantastic, you know, web-based app or something that young people would say, this is what we want the research to be translated into. So that's why it's important to listen to young people, because they actually gave us that feedback right throughout the life of the project. So I think it's early engagement, and ideally could have co-design and partnering in projects. But if that's not possible, because it sometimes just isn't with the way funding bodies fund projects, bringing young people in and insisting on having a budget for that is something that we've advocated for. And AAAH just a couple of weeks ago published some guidelines, a guideline for remuneration of young people who are brought in as youth consultants into projects. And you know, we hope that that is something that's useful and utilised by all sorts of different organisations, because young people, not only do their voices need to be heard, but they need to be appropriately remunerated in the same way that you would remunerate or acknowledge any professional when you wanted their opinion about something.
I would just absolutely echo that. Listen was the main thing that I took to write down, and then amplify and to have voice, to actually represent voices in authentic ways. And I was just madly trying to check on our Twitter feed that we have been running a series of voices of young people. We're wanting to do more of that, so we would very much welcome people getting in touch. But my number one lesson actually on that came as a parent and a journalist, running, just helping out with a school newspaper. And when the kids started doing stories for it, I was editing as an adult, trying to make them appeal to other parents, and I killed them. And once I let them speak through their own voice, or didn't impose myself upon them, it was powerful writing, fantastic. And I think that, yeah, that listen and amplify.
Thank you for that. I think that's a very important input. I think we have time for one more question that we received from the audience. So the question is from Neymar. What are the most effective ways to communicate the importance of health issues related to young people, such as, you know, suicide, depression in young people, to more conservative-minded communities? You know, we've seen a lot of communities see issues like depression or mental health issues as a taboo, as a stigma, which is a shame in the 21st century. So how would you say we, you know, properly communicate the importance of this to those, you know, community members and just, you know, individuals alike? Because, you know, a lot of people are suffering in silence when it comes to these issues, and they just want to be heard. They just want their, you know, problems or issues to be, you know, acknowledged. And, you know, how do we move forward when it comes to those communities in general?
Just very quickly, I suppose I would say that the communication, that personal stories are powerful. And so sharing stories, telling anecdotes, but in a way that is, what's the word? Not, you know, not angry, not too emotional. That's kind of passionate, but also, you know, just calm and serious at the same time. So I think, that's one aspect, is about personal stories being really powerful. The other thing that I think is, you don't see anything of much a lot in social media, and is about being curious about people who have a different point of view to you. And that takes time. You know, it's very hard with a however many character tweet you're allowed to have, to sort of be curious about. I'm seeing some, banter, worse than banter going on at the moment between some colleagues around the COVID data, people disputing figures and numbers and kind of becoming a bit tribal and saying, oh, well, New South Wales is hopeless and Victoria's better, or vice versa, this kind of thing. And sometimes I think, oh, they're just joking and having fun. And sometimes I think, no, actually they're not. And I think it becomes very unhelpful when you just become adversarial. And it's about being curious as to why someone is saying that about something. So I think being open to other people's points of view while just being very committed to your own expertise and knowledge and sharing that in a respectful way, I think is really helpful.
I would add to that, personal stories are really important, and also the sense that they do not necessarily represent the entire issue. So it's looking for a number of personal voices. I would add, as a comms aside, that the idea of always having to have a case study is so crucial for media advocacy, but it's so very difficult and so fraught in services and in just the whole way it goes around. So that's problematic. But if you could forgive me for not talking about health or youth suicide issues and things like that, but just in the same way, interestingly about climate change, I was at a summit before we all got locked down, and Carmen Lawrence, the former Western Australian and Federal Health Minister, spoke, and she was talking about trying to reach across the political divide. And it was quite interesting. She had said the Adani convoy to Queensland that she thought was wrong for all sorts of reasons, not least that it was confrontational and that it didn't take on corporate issues. It, in fact, took on the people who work for them. But she said she was doing research, and that if they put climate change up as the first statement, talking particularly to regional communities, people would stop talking. And her approach was that you need to start with what is it that about communities, what is it that they love in communities? What do they want to retain? What feels threatened to them? And she said climate change ends up coming into the conversation in different ways, but it doesn't start with that. And she said even in coal communities to sort of say, well, what do you think the future of coal is here? What do you want your community to be doing in 10 years? That sort of thing. So I'm never sure about that as a journalist, but I think it's an interesting idea for how you do open up conversations that are so stuck sometimes.
Thank you for that. And I think that's a conversation that we can continue for a long period of time, especially when it comes to those communities and how we address them in the future. Unfortunately, that's all the time we have for today. Would like to give a big thanks to Marie and Melissa for their time today and their phenomenal presentations. I hope the audience members have learned a thing or two, especially the whole practical side of it and how we can address these changes going forward, and different tips and tricks when it comes to translating communication and the whole healthcare side of it. To get involved with the YHF, if anybody's interested, please get in touch with Caroline. She'll post her email address in the chat right now, and it's also on the event webpage if you need it. And quick note about the future sessions that we have for these webinars. There's one more webinar next week where we'll be looking at how research can be used to inform advocacy. So please don't forget to register and send your questions ahead of time if you have anything you'd like to get answered from our speakers. But on that note, again, thank you so much to our expert speakers, and thank you to the audience members. And also a big thank you to Caroline for organizing this. And yeah, so I hope everybody has a wonderful rest of the day. And if you have any other questions, please send emails through. And thank you very much.
Thanks so much.
Thank
Bye-bye.
you. Bye.
Bye.